The Emergency Medical Services, or EMS, at Trinity Health could be described as a complex system of services with the purpose of responding to medical emergencies in our community. We can break down the goals of Trinity Health's EMS by looking at three key measurements of effectiveness. One key element of measuring success is related to triage and time to care. Triage is the sorting and allocation of treatment to patients. The amount of time it takes from when a patient walks through the emergency room doors to that patient being examined and treated is critical. Our goal is to get that time down to 30 minutes or less. We face some key challenges with our current ER facility at Trinity Health, starting with the location and size of its ambulance bay. The current bay can only hold up to 3 ambulances, and patients have to be shuffled in one at a time through all types of weather. The only route in or out of the facility is into a busy intersection, which leads to traffic delays. Another key factor is the Trinity Health First Response Helipad. It is currently located on the roof of the hospital, where incoming patients have to be routed through an elevator to get to the trauma rooms below. This can sometimes take 4 minutes or more to navigate. Those are crucial minutes for first response patients. The new ER will feature key improvements to help us reach our time to care goals, including a fully enclosed ambulance bay with dedicated ramps leading directly into the trauma rooms. This also means large capacity decontamination and mass casualty are possible if needed. Up to 4 lanes of patient intake and triage at once. A first response helipad that sets in the same level as the ER with routing directly into the trauma rooms, cutting transport time down to under 1 minute. That brings us to our second key measurement, the number of patients treated per day. The current ER was built with expectations of 12,000 patients per year. That's about 32 patients per day. The actual number of patients seen is closer to 100 patients per day. That is roughly 35,600 patients per year. This is nearly 3 times the intended capacity of our current ER. The new ER will feature key changes and additions to solve these issues, such as an increase from 13 beds to 27 beds. Exam rooms will be enclosed rooms instead of just a curtain divide. This will also increase privacy and quality of care for each patient. Treatment within triage for low acuity and rapid placement to rooms. And an overall design that can flex with the higher intake of patients. And finally, our third key measurement is quality of care. Every detail of our new ER has been designed to maximize the quality of care for our patients. Every room will be multifunctional and suitable to handle multiple needs with more comfort, space, and privacy. Without a doubt, Trinity Health's emergency medical services are a vital part of our community, and we are committed to providing the highest quality care. Please consider donating to the Trinity Health Foundation Capital Campaign Emergency Medical Services Project. Every donation helps bring another element of this vision to reality.